welcome to the Premier Power Week. I'm Fabiana Bacchini, Executive Director of the Canadian Premature Babies Foundation, CPBF, and your host for this event. The Premier Power Week is the second of two international live series that CPBF is hosting in 2020 in recognition of World Prematurity Day. These education sessions are in collaboration with International Family Integrated Care Committee, the Canadian Association of Neonatal Nurses, EFCNI, and GLANCE, the Global Alliance for the Newborn Care. For those not familiar with CPBF, we are a charitable organization, and our mission is to support and educate Canadian families of premature babies every step of the way. We believe that through consistent information, access to helpful resources, and peer support inside and outside the NICU, we can empower families, ensuring they are ready to care for their baby. Consistent information is especially important today when we are facing a global pandemic. With educational sessions like this, we intend to bring you the guidance of healthcare professionals and the knowledge gathered by researchers around the world. These are valuable tools to help our community raise awareness and advocate for the well-being of families and their babies. I would like to thank AbbVie for the unrestricted educational grant and Pampers for supporting the Premier Power Week. And today we are starting to started these sessions talking about parental presence in the NICU. We're going to talk about family integrated care, or FICARE, parents as primary caregivers in the NICU. Dr. O'Brien will present on why parent engagement in the care of their infant in the NICU is important for both the infant and the family, and how parental presence needs to be supported even during the COVID-19 epidemic. Dr. Karel O'Brien is a staff neonatologist at Mount Sinai Hospital and associate professor of pediatrics at the University of Toronto. She's a clinical teacher and neonatologist at a very busy perinatal center that specializes in fetal diagnosis and therapy, and also works in the follow-up clinic. She has trained in clinic epidemiology and healthcare research. Her current research has focused on the development of family integrated care, a model that changes how we deliver care to families and their infants in the NICU. And she has recently completed an international trial of this model of care. Dr. O'Brien, thank you so much for joining us here today. I'm always so honored to talk to you and to have you sharing your knowledge and expertise in this very important topic right now, parental presence in the NICU.
Good morning, Fabiana. Good morning to everybody else online. I think it's still morning or maybe lunchtime. It's a real pleasure to be here this morning. For some reason, my slides multiplied while I was waiting here on the screen. But one of the things, it's my great pleasure to be the first speaker during Premier Power Week. This is a really important time for families of preterm infants when we celebrate them and their families around the world. And really, the Canadian Premature Baby Foundation supports the dissemination and knowledge about family integrated care with our FICARE national and international steering committees to support the implementation of family integrated care across Canada. So why family integrated care? Well, my story of family integrated care began in 2010 as a member of a delegation from our hospital to Estonia to hear Dr. Levin and to see his model of humane care in action. Dr. Levin was a pioneer, and he really believed that the mother and the infant should be considered as closed psychosomatic system, and that everyday ward rounds in the NICU should focus not only on the infant, but also on the needs of the mothers. So why is this sort of model of care important? Well, it's really interesting, and we've learned more probably in the last 10 years about this, but that preterm infants have an increased risk of subtle challenges with learning, communication, moving, and behavior. And the behavioral problems specifically can impact the day-to-day function of the family and can have an impact on school success. The cause of behavioral problems appear multifactorial, including biological and environmental factors, especially the effect on parent-infant interactions. So research has shown us that when parents are involved in the care of their infants in the neonatal intensive care unit, that we have better medical outcomes with improved weight gain of the infants, decreased nosocomial infection, decreased parent stress and anxiety, reduction of readmission to hospital, and improved breastfeeding. There is also a potential for better neurodevelopmental outcomes. And we know this because the parent-infant interaction shapes the development of the infant. Parents are really important to the brain development of their infants. Attuned parents can provide developmentally responsive care, which impacts the infant nervous system and furthers normal development. I just want you to look at this little pictogram here, which shows you how much the brain grows while your baby is in the NICU. You can see a lot of the brain development and sulcation actually occurs while the baby is under our care. And we know that there is a real importance of the everyday interaction of parents with their baby in the NICU. The other issue is that parents in the NICU can suffer because of stress and separation, the trauma of NICU care, depression and anxiety, and that the parents' emotional state during their stay in the NICU and beyond will impact their ability to respond to their baby's cues and therefore may impact their infant's development following discharge. I know this was spoken to you last week by one of your other speakers, but there really is, there's good evidence that a stay in the NICU can actually be traumatic for parents. And parents in the NICU have many different stages of trauma. First of all, the unexpected early delivery. Secondly, seeing your baby who's ill and going through traumatic or life-threatening events, or even seeing other babies in the NICU. Also, serial bad news. The principles, therefore, of trauma-informed care apply to the parents as well as to the infant. This is one of my favorite quotes, and it is from Fabiana. Fabiana was one of the parents in our family integrated care study. And she says, "Through the dark, I could be Gabriel's mum. I was taught touch, the feeling, the interaction, and how all that became Gabriel's best medicine." And Fabiana has remained Gabriel's best medicine going forward in his life. And that's really what we want all parents to be able to do. So here is a slide just depicting the philosophy of family integrated care. Parents parenting in the NICU. The ideal healing environment for an infant needs to include the presence of parents, and their care is critical to their child's well-being. Parents need to learn how to take care of their baby and how to work with the healthcare team. Parents need to be collaborators in care, and they have a role in decision-making. Now, what I want to show you here is that family integrated care is a whole package. It's not just one piece of the model. So, for example, I have people who sort of say, well, parent massage alone, will that work? Or perhaps just parent support or parent counseling, will that work? And no, family integrated care is sort of like a whole system of care. It's almost looking at things through a different lens. And this sort of diagram here that we developed with Linda Frank, you can see depicts it as a model of parent-partnered neonatal care. And within that, we can facilitate parent-delivered interventions such as massage, or talking or reading to the baby, or parent support interventions like providing supportive physical environments for families or supportive psychological environments. But really, family integrated care is the whole model of care. It's not just those other things are one piece of the puzzle, but without facilitating parental presence, they all fall away. This is the model of family-centered care, because a lot of people ask me about, well, how does family integrated care different from family-centered care? And you can see here that in family-centered care, the model still focuses on professionals providing most of the care, not the family. The family is still really outside the sort of centrum of care, at least in the NICU. And the relationship is generally nurse-patient and nurse-doctor, so the nurse is really the gatekeeper of access to the infant. And this is a very simple diagram of family integrated care, but I hope I depict by the shading here that really here we're all working as a team to take care of the infant, as was in the previous diagram. But you can see here that the family are central to the model of care. And it's really the family who are gatekeepers to access to the infant rather than anybody in the professional team. I'm going to go quickly through the principles of family integrated care, but really they're based on the principles of family-centered care. They're not different than those. But really, parents are collaborators in the infant care, and parent learning is facilitated through a robust education program. The family are invited to participate to the best of their ability, and how they participate varies from family to family, depending on where they are in that stage of development. Through participation, parents are asked to present on rounds, not just be present. And this itself is a process. Parents grow into that role. Nursing education is critical so that they have the tools to enable family to be part of the team. The program has to be embedded in the NICU practice and policy. The entire team has to support the program, even, as I say, even the housekeeping staff. Anything else seems like a betrayal to the parents. So you can see we built this sort of what we call the 4 pillars of family integrated care: parent education support, staff education support, environmental supports, and psychosocial supports. And parent partnership is really the goal of this whole program and needs to be built into the model across all parts. This slide is really a slide depicting parent involvement. If you start at the wheel on the far left side of the slide, you can see the parents who come into the NICU, they come in with a strong sense of attachment. But then if they do not receive enough information and support or are unable to achieve their desired level of involvement, they're at risk for stress and conflict in the NICU. On the other hand, if at the bottom of the slide, you can see if parents' learning is facilitated, the parent can grow to become confident partners in care. And this is what we want to achieve with family integrated care. You need to provide a robust parent education program with both small group classes and in-person coaching at the bedside to truly practice family integrated care. This slide here depicts how parents grow in their skills. So we, as I mentioned before, we invite parents to participate on rounds to their best of their ability in family integrated care. So you can see at the beginning, parents may start just as listening to rounds, but over time in the NICU, they actually will introduce and give report. This is a lot different than just parents being present on rounds. You can also see that there need to be NICU environmental supports to promote prolonged parental presence. Of course, there are challenges to family integrated care. One of the challenges is the changed role of nurses. They will actually ask nurses to be supporters rather than doers, that they actually are partners rather than having full control at the bedside. And we ask our nursing staff to be educators of parents. So what about the impact of family integrated care? Well, we know that family integrated care, from my studies and from others now internationally, this causes better growth of infants in the NICU, more successful breastfeeding on discharge, earlier discharge home, better weight gain and earlier suck achievement, better self-regulation at 18 months corrected age, and better motor development at 2 years of age, and better growth following discharge. Parents have told us that FICARE has actually helped them develop better hands-on skill in the NICU, a closer developmental emotional bond, with their infant. They feel confident and competent taking care of their infants on discharge, and they value the friendship and support of other parents. We've also shown in our studies, in our randomized controlled trial, that parents have decreased stress and anxiety on discharge from hospital and decreased stress related to parenting at 18 months corrected age. And what do health professionals tell us? They say that family integrated care has helped them develop a better relationship with families, and it's satisfying to see parents become more competent in communicating with staff and taking care of their infants. So what happened to family integrated care with COVID? I hear all of you telling me the first things that went up were the big stop signs outside our NICUs. There was a study done in the United States by this group, and they reported a cross-sectional survey of 27 NICUs. And you can see that 47% of them had restricted parental presence, most only allowing a single parent to visit in a day. In 7 sites, 3% of them actually completely prohibited parents. So what happened in our response to COVID? Well, I feel that we went back to our old patterns. Our fear of the spread of COVID in our NICUs, the infection of staff, caused us to go back to our usual pattern of care, close down the NICUs, protect our babies. We did not reach out to families. We did not provide education or support to families so that they could better work together with the staff in the NICU. Luckily, we had parent advocates across the world, not only the Canadian Premature Baby Foundation, but also EFCNI and PLANS, who actually advocated for zero separation, together for better care, even in the time of COVID-19. We also had a number of parents who went to the media, and lots of media's reports of the problems and of parents being separated from their infant in NICU. Our team did a review of the literature on the effect of COVID policies on NICU parents and infants. And we found that there's an increasing concern with maternal mental health because of these visiting or parental presence policies. There's also been decreased support for breastfeeding for families in the NICU during COVID. There's concerns around parent-infant bonding. There's been a huge inconsistency across Canada, the United States, and internationally about how parents and infants are cared for across different hospital sites. The infection control policies are different at every hospital. There's also been a concern with the effect of parental wearing of masks on infant speech and language development and on parent-infant bonding. So you can see here is a slide just depicting our national family integrated care co-investigators. This group, alongside with our international family integrated care group, came forward with a statement on parental presence in the NICU during COVID, which we have published on our family integrated care website. And here are some of the pieces of that statement. I'm just going to go through them. First of all, it was basically the guiding principle of this statement is that parents are caregivers, not visitors, and therefore their presence in the NICU should be protected in the same way that other care providers are. So parents should be involved in their infant's care without time restrictions. Both parents should be with their infant on the neonatal unit and postnatal ward unless they are symptomatic or have been advised or required to self-isolate or quarantine. Parents should be provided with the same protection, that is the face mask or protective equipment, as other staff. Parents and staff should adhere to physical distancing policies in the neonatal unit and postnatal ward to protect each other as care providers in the hospital. All parents and staff should be educated and apply appropriate hand and respiratory hygiene measures within the hospital and the home environment. So I think it's really important to actually tell parents how to protect themselves at home and in the home environment so they're less likely to infect other care providers in the hospital. Where possible, a dedicated space should be provided for parents to safely eat and rest on the neonatal unit or nearby so they're close to their infant. Appropriate technological support, including video calling and apps, should not be used to replace parental presence in the neonatal use, but can be used to support parental involvement and communication. We found across the world, a lot of people are using apps or electronic communication with families to support greater communication with families, and that's a great idea, but it actually should not be used as a way of excusing not bringing parents into the unit. That was a really important point that our team wanted to make. We also felt that neonatal teams should make every effort to provide additional measures to support parental presence during COVID. For example, providing medical grade masks for families if that is what is necessary to support their presence in the unit. So the questions about mask and development is really interesting. We did make a comment in our statement about masks as follows. Where a safe physical distance can be maintained between staff and families, parents should be supported to take care of their infant at the cot side without wearing a mask covering or with a clear face covering if available. But how that's actually put into action in different NICUs depends on whether there's a single room design and whether that can be facilitated or not. So going back to our FICARE wave, this wave started 10 years ago. This was my son, he's now 18. I think this is probably when he was about 8 years of age. But our FICARE wave was a very small wave when it started. And now we've grown into a huge tsunami with different studies across the world looking at the importance of family integrated care. Here's one of my favorite slides of Fabiana Schuli, who was one of the leaders in family integrated care and actually stimulated me to look at this issue and supported our first studies in family integrated care. And here we are at our first family integrated care conference in Banff at the end of the cluster randomized control trial. We felt at that time that we had started a wave and that there was that point we had already reached a point of no return with family integrated care. We cannot lose hope now, and we will continue to promote parental presence in the NICU. I have to say I'm reassured that the second wave of COVID has challenged our hospitals, that most hospitals have been much more careful about what they are doing with parents. And we hope that this will remain so going forward. We're going to try and get our statement on parental presence published in a medical journal the next, hopefully in the next month or so, and that again will hope promote family integrated care. I love this hopeful sort of slide. This was when I think our last trip before shutdown for COVID. When you're at the end of your rope, tie it and knot and hold on. I really think our family integrated care steering committees and our international collaborators and our parent collaborators need to continue to promote family integrated care despite the challenges of COVID. Again, thank you to the Canadian Premature Baby Foundation for promoting this, and I'd like to support them during World Prematurity Day, and please don't hesitate to donate and support Canadian Premature Baby Foundation over the next few days. And thank you to all my national, international collaborators for family integrated care studies. Thank you.
Thank you, Dr. O'Brien, so much for your presentation. I always love to hear about FICARE, and obviously FICARE has changed my life. I was part of the research study at Sinai in 2012, and my son was admitted there, and I was part of that study, and it was absolutely life-changing for me. That changed my career, get involved with this community, because I really felt empowered, and I was able to advocate for my son in numerous occasions. And that's what I now do at the foundation, because I felt that was my role as a parent to continue the work and collaborate with the FICARE team. So there's so many questions I have to ask you, Dr. O'Brien, because it is a very challenging time. And in the beginning of the pandemic, you were fearing that we were going back 20 years when there was no family-centered care and parents were still seen as visitors, and we still see how many papers they call us visitors. They put visiting hours, and this is absolutely devastating. I feel that we did go back. How can we now move forward, knowing what we know for COVID, the spread within babies in neonatal units? How can we move forward to make sure parents are still part of the care, is still part of the care team, and work together with hospital staff?
Fabienne, I think basically the policies that happened during COVID came out of the fear of staff, around the fear of spread of COVID in the NICU, probably from parents to staff. So I think one of the things that's really important is that parents know how to protect themselves at home in their transit to the hospital, so they're less likely to actually cause an infection of staff members in the NICU, or less likely to transfer the infection to their infant. One of the ways to do that is really to follow good public health guidelines. So parents of babies in NICU probably need to go over and above the usual practice. They need to really limit their exposures outside the hospital, try and keep their bubbles small, so they're less likely to cause an infection in staff. Does that make sense? The other thing is, I think parents can really lobby with their hospitals around making sure that they are provided with the proper masks to actually better support their presence in hospital. Again, I think that's an important piece of the puzzle. Do not hesitate to ask the NICU staff to appeal on your behalf to actually change the hospital policy. That's what we've had to do at Mount Sinai. But these policies are bred out of fear and lack of knowledge. And again, right now, I think people are even more fearful because we know that 60% of transmission is happening probably from asymptomatic COVID patients or people who are infected with COVID but are asymptomatic. And so I think really the only way parents are going to be able to maintain their presence in the NICU is by not causing outbreaks and by showing us that they can do that really well.
Absolutely. So I just want to say hello to a few people joining us here from Indonesia, Uganda, and Melinda Cruz from the Miracle Babies Foundation Australia. Melinda is such an advocate for parental presence in NICU. I know she was also part of the FICARE study. And thank you, all of you, from watching us from all over the world. Dr. O'Brien, we have a comment here, actually a question. In an open bay NICU where babies are in a tight quarters, how can we try to ensure that parents can be in the unit together at the same time? So from the same person, Karen Beatty, hello, Karen, from Hamilton, Ontario. Can there be a discussion on circumstances where exceptions from policies about visitation by parents and siblings can be made? For example, palliation. Babies who have been in the unit for a long time, parents need each other.
Yeah, so I think you've probably put a few questions there together, Fabiana. Can you just go back to the first one? Sorry.
First question, in an open bay ICU where babies are in a tight quarters, how can we try to ensure that parents can be in the same unit together at the same time?
So I think I think we need to follow infection control guidelines. I think people need to wear a mask and need to wear a mask properly when they're with their baby in an open bay ICU. I think they need to try and stay 6 feet apart if possible, and the bed spaces need to be 6 feet apart. But other than that, parents should be able to be present with their masks in the NICU. When you look at when parents go to grocery stores or when parents go to other environments, and again, that's what needs to be there. So wearing masks and 6 feet possible away if possible, and I think just that's really what needs to happen. So it shouldn't prevent parents from being present. The guidelines need to be the regular public health guidelines. Similarly, if a nurse or more nurses are in that environment, again, trying to just maintain, wear a mask, wear it properly, and trying to stay distance from the parents if at all possible. Of course, when doing a transfer for skin to skin care or some of those things, you're going to be closer to parents. I think just trying to maintain your distance when at all possible and minimizing the very close time with families.
So for you,
go ahead, Diana. I think the other question was around palliative care or having special guidelines around that. I think that's a really important piece of what needs to happen. And certainly we've been able to lobby at our hospital. I know across Canada, many sites have been able to lobby that where there is when it's end of life situation, that extended family should be able to come and visit. Again, I think that's going to be on a site-by-site and a patient-by-patient discussion. One of the ways we've been able to do it in our unit, and I know others, has been actually to have a single room that's actually where the patient can be moved and that extended family can be invited into that room with the infant to facilitate greater visiting, greater number of people in the space at that time. However, again, it's the same issue around people need to be able to protect themselves when they're there. So even if grandparents are with parents or with extended family in an enclosed space, unless they're all living together in the one home, again, they need to wear masks when they come together and are in a small room together. So I think the second wave, I believe, is probably scarier than the first wave because we know more about the virus in some ways. I think we also know better how to protect ourselves. And I think the 3-level mask, as has been recommended by public health, is really important. Medical grade masks are perfect if we can supply those to families when they're in our environment. I think that's really important. And I think that's the way people need to protect themselves when they're in close quarters. What we do not want to happen, and I think nobody wants to happen, and this is why I think parents and families need to be brought into this discussion, is nobody wants our hospitals, our NICUs to have our nurses not turn up at work because they're sick or because they've been exposed. So I think all of us just need to work together. And that's why I believe it was really important to bring families into this discussion from the outset. Families need to know how to protect themselves at home and how to protect themselves on their way to the hospital and how to protect themselves in the hospital. That's a key piece.
Absolutely. Let's talk a little bit about technology. You touched on technology, and earlier this year, CPBF in collaboration with Pampers, we donate grant. I mean, we gave grants to 8 hospitals across Canada to implement technology to keep parents and babies together. But it was never an idea to substitute parental presence, but really to enhance that piece between parents, especially with extended families or siblings when they are no longer able to come into the units. So how do you see technology playing a role in the NICU during the pandemic and beyond? Because now we know this is not a short-term thing as we thought in the beginning.
Yeah, I think that's a really important piece, Fabiana. So one of the things I try to emphasize in my presentation is the importance of parental presence. Parental presence is really important for the development of the newborn brain, and I think we cannot underestimate that. What technology does, though, is support the communication, particularly between staff and parents, and I think that's a key piece of this puzzle. Staff in some units are scared of being close to parents because they do not want to get infected. That is the fear of COVID, and I think that we have to recognize that. What technology does, though, is one, allow our staff to communicate more clearly with families. I think that's important. We have in our own NICU, we've had a lot of parents who actually attend rounds virtually. So they meet the whole 10-member team of rounds through an iPad. And I think parents have really gained confidence about what's going on in their baby's care, have had some sort of transparency in the discussion about their baby's care plan, and really do gain confidence in the knowledge of their baby and what's going on in their baby's care using that sort of technology. The other thing is that we can use the technology to actually help with that attachment piece between parents and infants. And I think that there probably can be further study done in that area. But for example, apps such as the vCreate app that's been used by the group in Glasgow, sending little short videos to families or sending messages to families is really important way of promoting parent-infant attachment. And I think that's another piece of this puzzle. But none of it replaces parental presence. And I don't want us to forget that parental presence is a different piece of this puzzle. And we need to continue to promote that despite COVID.
Absolutely. So early in the pandemic, we were discussing this augmented care. Can you share what is it?
So augmented care, this was a proposal that I wrote at the beginning of the pandemic in March, where I was really concerned that we were going to have a shortage of NICU neonatal nurses to take care of babies in the unit. Luckily, that hasn't happened so far. And I reached out to our colleagues in Winnipeg to see if they've had any challenge with nursing staff or in Vancouver. And so far across the country, there has not been a challenge with the supply of nursing staff in NICUs, which I think is really a tribute to the nursing staff. The nursing staff have been protecting themselves. And I have to say, it's also a tribute to our parents, because our parents have not been a source of COVID outbreaks in our NICU today, which is fantastic. So but augmented care, the idea there was, in the case that we had a shortage of nurses, in our NICUs, whereas there was a subgroup of infants and a subgroup of parents who could actually take on even a greater role as almost nursing assistants in our NICUs, and making that a more clearly defined role. I still think there's a potential for that role. It may not be needed for COVID, but I'm not giving up on the idea. particularly for babies who have complex care needs and really just need parental care while in hospital. We may be able to create a slightly different environment for those families so they can provide greater care for their infant prior to discharge.
Absolutely. Dr. O'Brien, thank you so much for joining us here today. We have so much more to talk about, but unfortunately our time is up. But you're always welcome to come back to our Facebook Live. As you know, we do every Friday. So thank you, and I hope everything stays well during this new season, our winter season coming up soon, and the second wave of COVID. So thank you.
Thank you very much, Fabiana. Thank you, everybody.